Good afternoon, everyone, and welcome to our Lunch and Learn, Reconnecting with Psychological Support Services, or the PSS. My name is Dane Purcell, and I am the CESPHN Mental Health Program Officer, and I'll be presenting this workshop today. Firstly, I'd like to start by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognise their continuing connection to land, water and community, and pay respect to elders past, present and emerging. I'd also like to extend that respect to any Aboriginal colleagues who may be joining us today. So please note this webinar is recorded and will be available on all of the CESPHN YouTube channels within the next couple of days. At the end of the webinar, the evaluation survey will pop up in your web browser, and we do appreciate your feedback. So please complete this to allow us to issue certificates of attendance. Make sure that you submit your questions to the speakers, that is myself and Nadine and Kate, who have joined me, using the Q&A button at the bottom of the screen. And we will get started. So, this over. As I mentioned, my name is Dane Purcell and I'm the Mental Health Program Officer at CESPHN. Today, I'm going to reintroduce and talk to you about the Psychological Support Service, which is more commonly referred to as the PSS. I'll be talking about eligibility into the program, capacity and support that's available, as well as referral pathways and communication within the program. There'll also be some time at the end of the presentation for any questions that you might have. And I am actually also joined by the CESPHN clinical lead, Nadine Rose, and our triage clinician, Kate Rankin, who will help facilitate the questions. So if you have any questions related to any clinical natures regarding the program, please make sure to pop them in the Q&A, and we'll get around to them at the end of the presentation. So in addition to the earlier acknowledging the traditional custodians of the land on which we work, I'd also like to further acknowledge all the people, families and carers with living and lived experience of mental health, drug and alcohol, and of suicide, and recognise the valuable contributions that they make in shaping both the supports and programs of the region. So let's get into it. Psychological Support Service, PSS. So this offers free short-term psychological therapy to individuals who face mild to moderate mental health concerns. The sessions within the PSS can be delivered either face-to-face or via telehealth. That really is dependent on what is most accessible for the client, and can be essentially worked out during the referral process. So whatever their preference is, you can put that into the referral, and then that way we can allocate that client accordingly. So this map highlights the geographical boundaries of our region, which are important. CESPHN aligns with the southeastern Sydney and the Sydney local health districts, and the catchment area includes 13 LGAs, which cover, as you can imagine, quite a diverse and densely populated part of Sydney. We're bordered also by several other PHNs. So Sydney North is to the north, as you'd expect. Western Sydney is to the northwest. Southwestern Sydney is to the southwest, and southeastern Sydney is to the south. So it is important to know and understand these boundaries and regions, as if your client resides outside of the CESPHN region, you will need to refer them to the most appropriate program within their region-specific PHN. So for instance, if your client resides in Bankstown, as you can see by the unhighlighted part of the map on the screen, you will need to refer them into Western Sydney PHN equivalent of the program. Okay, so getting into the nitty-gritty of the actual program itself. So each client can receive up to 10 sessions per episode of care. So this includes a maximum of 2 sessions, which are dedicated to care coordination. And in some cases where there are extenuating circumstances, up to 8 additional sessions might be approved. However, this is not automatic. These requests are reviewed on a case-by-case basis by our clinical lead and the clinician who is supporting the patient. So for example, if the clinician and our clinical lead both agree that the client requires, say, only 3 more sessions to complete their care, then only 3 of the 8 available sessions will be approved. Again, if you have any questions about any of these slides as we move along, please pop them into the Q&A and we can address them at the end. So it's important to note that unlike Medicare subsidized services, patients cannot reapply for a new set of sessions each calendar year. So once the maximum number of sessions has been completed, the episode of care officially concludes. If your patient requires further psychological support beyond the PSS, their allocated MHP, the mental health professional, who is allocated to them at referral entry will make the appropriate recommendations, which can be communicated to you in their final report. For example, if the client has completed 18 sessions but still requires further psychological support, the MHP may either recommend a different program for referral or request a mental health care plan to continue the treatment with them under, say, MBS. So in terms of the process in which to refer into the program, referrals to the program are triaged by the CESPHN Mental Health Intake and Triage team, and they can be submitted either through the online service referral form, which is on our website, or via HealthLink using your clinical software, medical director, or best practice. Our network of mental health professionals engaged in the PSS includes a number of registered clinical and general psychologists, mental health social workers, and mental health nurses, among others. This ensures that your patients receive a high quality, specialised professional care at all times. So within the referral form, you can nominate for your client to be seen by a psychologist or a mental health nurse as a preference. However, that cannot be guaranteed. Obviously, it depends on clinical capacity at the time the referral is received and the capacity of the actual MHP whom it gets assigned to. So the PSS has a number of eligibility criteria, which is specifically designed to support individuals who are deemed underserviced in our area. So first, they must live within the Central and Eastern Sydney region, like I mentioned earlier. And secondly, they need to have a diagnosable mild to moderate mental health concern. This is important as the program is not intended for crisis care or complex long-term psychiatric conditions. Thirdly, your patient should be likely to benefit from short-term intervention. That's basically meaning their mental health concerns are manageable within the program's structure and format. And finally, the service is for individuals who are experiencing financial hardship. So those who are unable to access other services like Medicare subsidised psychological therapy through better access. To give you a clearer sense of what financial hardship means in the context of this particular program, the income threshold for the program is below $67,000 per annum for individuals or $140,000 per annum for families. So while the PSS program does offer valuable support, there are certain situations where it might not be the most appropriate service for your client. For example, this program isn't suitable for individuals who are seeking specialist support for domestic or family violence. It's also not designed for those involved in any work development orders or WDOs, or with legal, forensic, court, or insurance-related matters. Furthermore, this program is not intended for people in crisis, those with severe mental illness, or individuals who are in need of long-term or ongoing psychological treatment. Excuse me. It's important to note, though, that patients do not need a Medicare card to access the program. However, those who are already participating in an NDIS program that includes psychological therapy are not eligible for the program. Psychological support should already be available to them through their existing funding within their NDIS plan. So these exclusions, I beg your pardon, are important as they do help us to ensure that the program remains focused and accessible for those that it's intending to support. So moving on to the populations whom the program services. So the PSS supports a wide range of individuals across different life stages and various communities. This includes children aged 0 to 12, young people aged 12 to 25, adults on low incomes, which I refer back to the eligibility low income threshold, people who identify as from the LGBTIQ+ community, individuals experiencing perinatal depression, as well as their partners, people who identify as Aboriginal and or Torres Strait Islanders, individuals from multicultural backgrounds, and those who have attempted or are at risk of suicide or self-harm, and individuals with a mild intellectual disability. So while the PSS does support clients of any age, there are a few limitations to note. We don't provide home visits or court reports, and unfortunately, we're unable to accept self-referrals into the program. We also don't offer family therapy, so if more than one family member is referred, they will likely and must be seen by different clinicians. To ensure clients are matched with the most appropriate clinician in their population as well, it's essential to select the correct referral stream when completing a referral. So for example, Clients referred under the Aboriginal and Torres Strait Islander stream will be connected with a clinician who has completed the required cultural competency training. Similarly, clinicians working within the child, perinatal, and suicide prevention streams must have specific training and experience to provide the necessary level of care to individuals within those cohorts as well. So this is just to ensure that your patient receives the most appropriate and professional support available to them. So here is a brief, very brief overview of the referral process for the PSS program. We have simplified it down just to make it easier to understand. So first, the patient's referred to the program by you, their GP. As I mentioned earlier, this can be done using the online referral form or HealthLink through best practice or medical director. So once you've submitted that form, the referral is then triaged by our CESPHN triage clinicians. They assess whether the client is suitable for the program and either approve the patient's initial sessions or recommend an alternative service if they don't meet the eligibility criteria. So it is likely that you will receive a phone call from the CESPHN triage team to discuss the referral. So I do encourage you to ensure that your phone number is entered correctly into the referral form, because if triage are unable to contact you directly to confirm certain details of the referral, it might be declined. This is to ensure that there are no long waiting periods for clients who are looking to get into the program and to ensure that we service them as soon as possible. So if the referral is approved, it's then assigned to one of our service consortiums. They go by the names of APMA or Lily Pilly Counselling. You might have heard of one or both of them. And then from there, the consortium allocates the referral to a mental health professional who will contact the patient to arrange their first session. So once that referral is accepted by the clinician, you, the referring GP, will receive a confirmation email. It's therefore important to include an accurate email address in the initial referral to ensure that those communication channels are kept open, they're smooth, and all communication is made in a timely manner. So generic email addresses such as info@GP practice are not recommended if they aren't monitored on a daily basis. So moving on to communication aspect of the program. So part of the program, the assigned mental health professional is required to complete and submit a comprehensive assessment and treatment plan to you, the referring GP, between sessions 1 and 3. So this is to ensure that you are informed of your patient's progress and the agreed therapeutic approach earlier in their episode of care. At the end of the treatment, the MHP might also provide, or they must also provide, a end of treatment final report or a progress report, depending if they're seeking additional sessions. This final or progress report will outline whether further sessions are recommended or if the episode of care has been successfully completed and the referral can be closed. These communications are key to maintaining continuity of care between yourself and the MHP and your patient. So moving on to the suicide prevention service aspect of the program. So a way to think about this particular aspect of the program is that this is a program within a program. So the PSS Suicide Prevention Service offers additional support for individuals who are aged 18 and over, who are at increased risk of suicide or self-harm. Once the referral is made into the SBS stream and is approved and assigned, patients are contacted and typically begin sessions within the week. Patients are offered 8 suicide prevention sessions, which are utilised over a 3-month period. These sessions are separate from the general PSS sessions. So if your client begins in general PSS and they complete 10 sessions and then they are stepped up to the suicide prevention service, they will get 8 suicide prevention service sessions after that initial 10. So this stream prioritizes individuals who have recently attempted suicide, they've engaged in self-harm, or are experiencing significant suicidal ideation and who are best supported in a primary care setting. The MHP's focus of this particular stream is strictly on suicide prevention. So this includes identifying early warning signs, addressing risk-taking behaviours, and building safety strategies with the client. It's important to note that this is a short-term, time-limited service, and it's not designed for delivered, focused psychological therapy. To access the service, a GP mental health treatment plan is required. This can be uploaded through the online referral form, as I mentioned previously, or can be included in the HealthLink referral using your clinical software. Both referral pathways are fully compliant with the billing requirements for a GP mental health treatment plan, so you don't need to do both. So going over and more in depth into the eligibility criteria, because it does differ slightly to PSS. It's important to note that only you, GPs, can refer clients directly into the SBS stream. So while this stream offers additional support, all standard PSS eligibility criteria must still be met in addition to the SBS criteria. So as I mentioned just previously in the slide before, this provides specific service for individuals aged 18 and over who have attempted suicide or experiencing heightened suicidal ideation, but they are no longer considered at acute risk. So they must be stable enough to be supported within this primary healthcare setting. The SBS stream is not appropriate for individuals who are at acute or immediate risk of suicide or self-harm. In these situations, an urgent referral should be made to the relevant state government acute mental health team. So as I mentioned before, in terms of stepping up clients to the program, patients who are already engaged in the PSS program, they can be eligible to step up if their risk level increases during their episode of care. So in these cases, the assigned MHP will request the step up and send a letter notifying you, the referring GP, of the change of circumstances. This is just to keep you informed of where your patient is at in terms of their mental health journey. So I've spoken a lot about the eligibility and the capacity. I'm going to now speak to you briefly the PSS and SBS referral forms. So the next few slides will walk through the referral pathways and the forms that you'll need to complete in order to refer patients to the program. Referral form templates for both best practice and medical director are available on the website. We have also provided step-by-step instructions on how to upload these templates into your clinical software. So if yourself or your practice manager need help doing so, those templates are there to aid you in that aspect of it. And there's also these instructions are also available as separate downloads. Alternatively, if you're not using or you do prefer not to use best practice or medical director, referrals can be submitted through the online referral portal, which is accessible on the website also. So this slide shows a screenshot of what the website's homepage looks like to help you locate the referral form easily. So to access the online referral form, simply go to our website and look to the bottom right hand of the screen. I've highlighted in that little red box, which you can see just here. If you click on that link labeled mental health referral forms, this will take you to the health referral forms page, which is this one. And then if you then click on the mental health services referral form, PSS/PICS, just one at the top, it'll take you directly to the online form. Once you're there, you can complete and submit the referral form for your patient and get them started on their journey. So once you click that referral form, that PSS/PICS referral form, this is what will pop up. So it's a quick look at what the online referral form looks like. When completing referral form, make sure to select the PSS and PICS programs options to ensure it is routed correctly. If you click this one right here, you need to click this one, otherwise it will go to a different program. There are a few important points to keep in mind also when completing the online referral. So always include an appropriate email address, as I've mentioned before. This email is used for communication between yourself and the MHP. So it needs to be ensured that it is monitored routinely to make sure that you're not missing any updates or missing any important reports from the MHP in relation to your patient's journey. Once you've filled out the form completely, be sure to download a copy for your records before selecting a service provider. This is really important, as in rare cases where a referral isn't received due to possible technical issues with the website or the form itself, having a copy allows you to contact us at CESPHN and arrange for the referral to be processed directly. Downloading a copy of the completed referral also allows you to upload that copy to the patient's file on your clinical software. In instances where there has been an issue with the referral form and it hasn't gone through, you have downloaded it, please do not email it directly through to CESPHN. It will be deleted unopened. This is simply due to security and privacy protocols, and this will also delay your patient in receiving the care they need. So before you send it through in any manner, just give our central intake a call and they'll be able to aid you in getting that referral to us as quick as possible. Thirdly, you can also choose to upload a previous completed mental health treatment plan using the online referral form. If you do, the system will automatically generate a short form version of the referral, which makes the process a lot faster and more streamlined. So if you do have a previous mental health treatment plan, select the short form option, upload that mental health treatment plan, and then you just have to fill in a handful of other options in order to get that referral completed. So this is where the downloadable best practice and medical director referral templates can be found on the website. As you can see, just below where the templates are, you'll find instructions on how to upload them into your preferred clinical software. It's essential to complete all of the mandatory fields in the form. Doing so ensures a faster and more efficient referral process. So although it might take you a little bit longer initially to fill out the referral form, it will take inevitably less time for that referral to be processed, and it helps your patient access the program a lot faster. So as I mentioned earlier, please don't email these referrals directly to CESPHN. We will not read them and we will delete them, and we will not know where to then action the referral. We'll organize that for you when we give you a call. When completing the form in your clinical software, be sure to include various descriptive information in the following sections. So these sections are important as our triage clinicians look at these sections very carefully. Presenting issues, goals for the patient, crisis and safety relapse plan, the proposed review date of the patient's mental health treatment plan, and a completed mental state examination. Providing all of this information up front allows our triage clinicians to process the referral a lot faster, and is ensured is assigned to an available clinician more effectively. Again, if that information is missing, that is going to then prolong the time that we can action that referral, resulting in potential numerous phone calls and emails to you and your service. So if you're able to complete all those sections initially, it will reduce that time for completion. So I have come to the end of that initial presentation a lot faster than I anticipated, which is nice. It allows for some questions and answers. So I am going to stop sharing my screen now and just go to the Q&A. And I can't see that there are any questions there at this stage. Does anyone have any questions? If anyone has any questions about the service or about the program, please feel free to pop them in the Q&A now. I'll leave it open for a couple of minutes. If there's not any Q&A, I'm more than happy to finish up the presentation there.